Thank you, Governor.
Thank you.
As far as benefits go, there are many people who don't qualify for regular unemployment because their W-2s show small amounts of, say, $100, and that system doesn't allow them to file. But then they have issues receiving PUA benefits when almost all their pay falls under self-contractors. What are they supposed to do after a month of the system being up and they're not receiving anything? They keep being told DETR is working on it. Is there another answer to give them at this point for some guidance?
Unfortunately, there is not another answer. DETR is working around the clock to resolve these issues. We've gotten to as many of them as quickly as we possibly can. Unfortunately, the ones that are still having trouble are usually an isolated case that they have a specific instance, like you're saying, regarding their wages or whatnot, and they have to be handled on a one-at-a-time, case-by-case basis, and working through them as fast as we possibly can.
Is there any way to speed that up, that process?
We're working through them as fast as we possibly can. They have to be done individually, and it can take 30 to 60 minutes to do one claim, which means we've got folks that are in there, they're doing 12 claims a day. That's all that they can get through a day. And we've got people that are using robocalls to call into DETR's office, which is jamming the phone lines so other people can't get through, and it's making the problem more complicated. So we're getting to them as fast as we can.
Thank you.
When it comes to the contact tracing, do you guys have any data yet that talks about the protests and some of the businesses that have opened? And then if you do get some of that data pertaining to certain businesses that are opened, would you roll back some of the regulations or anything like that?
Go ahead.
I'll start with the contact tracing and the data. So we are analyzing the data related to this. We've added special questions to our survey so that when we do case investigation, we can track if they've been to a mass gathering, if so, which mass gathering. So we did pull data from June 4th to June 16th, and we recalled all those cases, so appreciate the patience of those cases who were called. Approximately 11% had been to a mass gathering, and 12% had been to a civic activist event. So that's something that will be part of our normal screening, and hopefully can provide more updates on that on an ongoing basis.
And with possible rollbacks, would that be possible? If
I'd hate to roll back an entire industry, but as we do, if we find out that, for example, bars are a lot of causing a lot of this, or if it's another activity that might be causing some of the surges, we will definitely consider taking action in those specific areas and probably have to make some adjustments.
Thanks.
Thank you.
I'll just add that we did also include now occupation on our case survey, so we will be getting data on occupation as well as places visited. So we should have much more robust data so that you can look very specifically at those things.
And just a reminder for the press coming to the podium, make sure you hit the button so the microphone comes on. Thank you.
Hello?
Okay.
Governor, we're about a week out from the first of the month. Can you offer people any assurance that they're not going to get evicted in 1 week? Can you say anything about when the eviction moratorium is going to
We're going to be addressing the expiration of the moratorium in the next few days. We're still gathering some data and talking to some of the groups that are involved in this, and we should have an update for that in the next couple of days as it relates to the eviction moratorium.
Do you expect there will be some sort of ramp down for folks that haven't gotten paid their unemployment checks and just have no money for this?
Well, there's a lot of anecdotal stories about individuals that have got unfortunately haven't got their PUA or their UI, and definitely something that we're considering, and we will have a phased-in or rollback approach as it relates to the moratorium on evictions.
Can you say when you guys will be able to provide details about the plan?
Since it expires at the end of the month, it would be in the next few days that we'll be able to do that. I'm guessing the next 3, 4, 5 days.
Thanks.
Thank you.
This button? Hi, Governor. You said the last thing you want to do is impose monetary penalties on people for not wearing masks, but just to be clear, is that what this order does, and will that enforcement require more policing?
This order is a mandate for folks to wear masks. The mandate is put on individuals and on businesses. We're hoping that they will understand the severity of the situation and voluntarily wear masks. It works. I mean, every responsible medical professional will tell you a mask helps reduce the spread of an infectious disease. Anyone who's denying that is just denying reality. So we will do an education, and we encourage businesses to comply, and we will use local business regulating agencies and state OSHA to go in and make sure that businesses are in compliance with this directive. And if they're not, they will face appropriate penalties.
Well, I understand the hope in regards to individuals, but if anyone out of the more than 3 million people in the state doesn't wear a mask, will that be enforced via monetary penalty or in other ways?
I would hope that we would not get to that point where I have police officers walk around with a ticket book for people. That's not what the intent of this is. And you're always going to get people that are going to say, what about this one person that's not wearing a mask? I want to get to the 95% of the people that understand it's in their best interest. If you're young and you're healthy, it might be okay for you, but you could be asymptomatic and you're spreading it to someone else. It's important that they understand that other people wear a mask for you. You wear a mask for other people. We need to do a better job helping people understand this. It is troubling and it's really discouraging that this has become a partisan issue about whether or not people want to wear masks. This isn't about partisanship. It's not who you're going to vote for president. It's not about your rights. It's not about, this is about protecting the health and well-being of everybody that you come in contact with. That's what we're talking about.
And we're going to keep moving with the questions. We've got a line of folks, so one question at a time, please.
Hey, Governor.
How you doing?
Good.
Good.
I'm curious how much of this latest increase in cases might be attributable to the fact that we're just testing a heck of a lot more people now than we were.
Okay, increased testing is not the sole responsible reason for our numbers going up. This right here has a lot to do with why numbers are going up. People aren't wearing these. That has a significant impact. The other thing that has had an impact, and it's on the positive side of the impact, is the contact tracing that we are doing. It works. If we test 100 people, that just at random, you test 100 people, you might get a positivity rate of 2, 3, 4% on those 100 people. But if you're testing 100 people that were identified through contact tracing, you're going to get a much higher rate because they were traced to this person. For example, if you got it, you were infected, and you identified that you were with Megan and 10 other people, and we tested those 10 other people, there's a more likelihood that they could have gotten it from you. And that's why some of the people are testing positive.
Okay, but what percentage, again, of the increase in cases do we think is attributable to just testing more, doing contact tracing better, that sort of thing,
I think,
as opposed to masks?
I think Ms. Peak can give an answer to that question, and then we will move to the next person.
So I don't have that information with me right now, but I'll say we know the equation to prevent it. We also know the equation to spread it. And so all of us can walk around the community and see people without masks, people indoors, close together, and we know that's how it spreads. So now we know how to prevent it. And I'll also add COVID takes up our entire lives now, across the news, daily discussions, and it feels so big. But it also ends up to be the individual behavior that's going to butterfly effect this. So as the governor mentioned, one person who's positive that gets in a car with 4 people, and those 4 people get it. And then those 4 people spread it to 4 more people, who spread it to 4 more people, who spread it to 4 more people. And it's attributed to that first case who got in a car with a group of 4 people. So it's really important to think about the individual when it seems like this huge pandemic and we as an individual can affect change. You absolutely can. And that's what we're seeing through contact tracing. It is the one person, and it spreads and it spreads.
Okay, thanks.
And I'm going to add that the biggest thing you see when you see the online and you've got the pictures in your paper and you see them on social media and you see 50 or 100 people crowded into a bar, nobody's wearing a mask, or they're walking through a mall and nobody's wearing a mask, that causes an increased spread. It's that simple.
Thanks.
Thank you.
Hi, Governor. I want to go back to Dieter for a moment. The director's departure on Friday, she cited threats to her personal safety, and that's happening in other parts of the country as well. Wanted to ask for your personal reaction to that. Also, are other staff, state staff, getting those kind of threats, and have you gotten threats?
I can't get into the details about our security plan. I've got my detail here with me, and we've got a whole team that tracks threats. It's unfortunate that Heather was put in this position, and sometimes people are just, I don't know if they don't think before they go online and say some of the things that they say or do some of the things that they do, but Ms. Korbulik should never had to go through what she went through, and we're doing everything we can to keep her safe and all of our state employees safe.
Timeline for replacement?
Hopefully relatively soon.
Thank you.
And we have time for a couple more questions for the governor.
Hi, so I know in the past you've been reluctant to enforce masks just because we've seen employees, workers get harassed, experience violence. Are you worried about workers in Nevada experiencing that, and what's in place to protect them?
Okay, I'm going to emphasize one more time that wearing masks should not be as partisan or an expression of your First Amendment rights or your philosophical views. I would hope that people would take this in a manner in which it's intended, to please wear a mask for everyone's safety. There have been incidents across the country. We hope that doesn't happen here. I encourage all businesses to, they're mandated, they've been mandated, they have their employees wearing them. Some of them are doing a real good job of that, and they are going to face the repercussions of that as we continue on our contact tracing, and we get our enforcement agents out into the field to address this. But everyone is mandated to wear a mask.
I got it. And does that include law enforcement as well when they're out in public?
That'll be up to the individual law enforcement agency as it relates to safety or an occupation, and you can find that all in the directives that are posted online.
Wait, I'm confused. So they're not mandated to wear masks?
Okay, depending on when they're making stops and the enforcement of their job, some of the sheriffs and police chiefs have opined that there's a safety issue. And we're leaving it up to the law enforcement agency to make that determination as it relates to their specific job function.
What would
We go
that
to the next question. There have been folks in line. Thank you.
Good afternoon, Governor. According to COVID Act Now, it's a group of healthcare professionals, universities, researchers. It talks about contact tracing as of June. It says Nevada has 400 contact tracers with an average of 334 new daily cases. We estimate Nevada needs 1,670 contact tracing staff to trace all new cases in 48 hours before too many other people are infected. This means that Nevada is likely to be able to trace 24% of new COVID infections in 48 hours. All these lower levels of tracing, it is unlikely Nevada will be able to successfully identify and isolate sources of the disease spread fast enough to prevent new outbreaks.
I'll handle that one. So we use that same math to develop our plan for contact tracing. And so I could say right now our contact tracers are available 24, from 8 to 8, 7 days a week. And their contact tracing, they have time to address the cases and contacts that are coming in front of them. We also have around 300 folks through the Nevada System of Higher Education that will be coming on in the next couple weeks. And I believe I did fill out that survey, and it was last month, and so that was accurate as of last month.
So do you need more? Do you need more tracers, and where would they go if they say, I'm really interested in doing that?
Great question. So I would encourage folks to look at the postings on our Nevada System of Higher Education job boards. I know the one for Northern Nevada is up and ready for folks to apply, so that's the best location, and then UNLV and then Great Basin College for our rurals are also recruiting.
Okay, thank you.
Yep.
Great, and thank you all for coming. Governor, do you have any closing remarks before we go?
No, I can take a couple more if you want.
Okay, Governor says you can take a couple more.
She gets,
Hi, Governor.
sorry.
The announcement that we're going to go to maybe a blended learning model, part virtual, part in person for schools, is concerning a lot of parents who are wondering how they're going to afford childcare and how they're going to be able to work. What are you doing to address those concerns?
Well, that's an issue that our superintendent, Joan Ebert, is dealing with our 17 superintendents in terms of how to handle that. They're going to come up with individual plans in consultation with their school boards and their parents and their teachers. And I support Joan's decision as it moves forward. That's something that they're working on.
Do you expect there will be an infusion of state money or anything to help build capacity for childcare?
There is no infusion of state money in the budget crisis that we're facing right now. I'm confident that Joan and the superintendents will come up with a plan that will work for everyone. Thank you.
And we'll do Sam as the last question here.
Okay,
Thanks.
last one. See, I got in trouble for taking 2 more.
Governor, New York, New Jersey.
Can you turn the mic on? Sorry.
Sorry, I think I turned it off.
Yeah, there you
Okay,
go.
cool. Got it. New York, New Jersey, and Connecticut have implemented quarantine mandates for visitors from high-risk states. I'm curious, given Nevada's tourism industry, what it would take for you to implement parallel mandates on tourists.
Well, I'm familiar. I know those governors from our National Governors Association meetings. Nevada is a state that's based on tourism. We're not going to get to that point because I'm confident that everyone is going to follow the directive and wear their mask, and we won't run into the same situation that they had there. I believe that if people are responsible, no shirt, no shoes, no mask, no service, we're not going to have that kind of an uptick, and we'll continue to welcome people from around the country and around the world into Nevada. And I want to compliment those businesses, especially the ones on the Strip and the businesses in northern Nevada that have opened safely and are servicing their patrons, are creating jobs and helping our economy. And I want to expand that and help that continue to grow.
Thanks.
Thanks a lot. Thanks for being here, everybody. Appreciate it.